Welcome to Recovery with Root, a podcast centered on topics surrounding mental health and addiction. Through our Advanced Recovery Institute, a new entity of the Root Center for Advanced Recovery, we are committed to research and training to elevate clinical care. We hope you find this podcast informative, and most of all, we hope that it helps improve the lives of others. Remember, we're in this together, and recovery is possible. Hello and welcome back to another episode of Recovery with Root. I'm Margot Farrell, Chief of Staff here at the Root Center for Advanced Recovery. So excited to be joined by Hope Payson today. She is a licensed clinical social worker and also an addiction counselor specializing in post-traumatic stress disorder, which is the topic we're going to be talking about today. Hope, thanks so much for joining us.
You're welcome. Happy to be here.
I've been doing a lot of research on you, and you've got an impressive background when it comes to post-traumatic stress disorder. You've done so much work on it in your career, and you have such an interesting approach to it. I guess just to start, talk a little bit about your involvement with what it is that you do in terms of post-traumatic stress disorder and how you use that to kind of impact your day-to-day.
Okay. So I started off working in community mental health, particularly trying to help people who struggle with addiction. And at that time, I was bringing people to treatment centers and giving them rides and picking them up. And in the long journey there and a long journey back, having a lot of conversation about their lives and realizing how much trauma they had dealt with and how dropping them off at treatment and picking them up for treatment on the way back, how much I could see the difference in them. I worked with them primarily when they were on the street, when they were using, and in recovery saw the trauma symptoms become very, very prominent. And it was at that time I got kind of interested in treating that so that folks had an even better chance of whatever pathway of recovery they wanted to be in, to make sure that the trauma didn't get in the way, because the trauma was getting in the way. So when I think about trauma, I think about unresolved pain, because a lot of people are kind of feeling like the word trauma is being overused right now. But most people who have a history of addiction have some type of adversity that they've experienced, either childhood adversity or community types of adversity, and it really affects the ability to maintain whatever recovery you want to be in. So I got very interested in that. Started training in evidence-based approaches to trauma. Primarily, I work using EMDR, which is an eye movement desensitization reprocessing therapy, which is an evidence-based approach to help people with PTSD. And I specialize in working with people with histories of both trauma and addiction. So I do a lot of work individually with people, but then I do a lot of educational work.
Yeah, I wanted to bring you on to talk about PTSD because just in doing research on the topic, I feel like a lot of times, as you mentioned, it's one, the term is being used a lot in the mental health space right now. And then two, a lot of times when people think of PTSD, they're automatically associating it with veterans or the military, but there's really so much more about it. And it's not just veterans who are being impacted by PTSD, clearly, as you're seeing with your work.
Yeah, I mean, I think when you see it in the media, it's always represented that way. So it's represented like, oh, a car backfires, and then all of a sudden the person feels like they're in Vietnam and they're fighting, and that's the representation that we get of it. And certainly that has affected many people being in those circumstances. But a lot of what I see in my practice and the folks that I've worked with had to do with things that happened growing up, had to do with things that happened when they were using, had to do with things that happened when they were incarcerated. So a lot of negative experiences. And it isn't always like, I don't know, somebody reaches out to you and you back away and you have a flashback of exactly why you're backing away. It's more that somebody reaches out to you and you back away because you feel like that's really what you need to do, but you're not exactly sure why. So a lot of good therapy with trauma is to help people go to the root, which I love the name of your place, is to see, why did that start? You know, one of the biggest barriers for folks in recovery is reaching out for help. And that's because they learned a lot about asking for help growing up that was very negative. Or they may have even had some really negative experiences in the system. So it's tracing it back, and asking the right questions. So instead of saying, you're not going to ask for help, well, you're never going to make it in recovery, more that I noticed you're not asking for help, and where did you learn not to ask for help? And a lot of times, if you trace it back, you'll hear all these memories of either help wasn't provided, or help was discouraged, or when I asked for help, I got hurt. So it's not always directly the way PTSD doesn't always look like it looks in the media. It can really look a lot different than that, and it causes significant barriers.
So going off of, what we see in the media, that kind of makes me think of a lot of the misconceptions that are out there. What do you think are some of the biggest misconceptions that we see?
I think some of the biggest ones are, in order to have a diagnosis of PTSD or to see yourself as somebody who has a history of trauma, you've had to experience some kind of physical abuse or sexual abuse. So a lot of times I get people coming in, and during their intake, they'll say, I don't have any history of trauma. And then I talk to them and I find out there was a lot of neglect. There was a lot of emotional abuse. There were things that happened that were quite violent, but because it happened so often in the family or maybe in the neighborhood, they thought of it as kind of normal. So I think it's really underreported, but I think it isn't always. Certainly sexual abuse and physical abuse are pretty profound in the impact they can have, but there's a lot of other things that can happen that can affect our behavior now. And that's what PTSD is all about. It's about how the past shows up now, and how it shows up now in ways we actually don't want it to show up, or in ways that actually aren't informative. So, if I learned that I couldn't ask for help when I was younger because the consequences were pretty negative when I did, and I don't ask for, help now. So it's kind of informing me it's not a good idea, even though it is a good idea now.
Do you think that there's a lot of people who struggle with PTSD and maybe not, they don't know that that's what it is? They can't identify that that's what they're struggling with?
Yeah, definitely. And I don't know if you've heard of the ACE score or the ACE test, where people are asked 10 questions to help determine how much adversity they were exposed to as children. And so a lot of people in recovery are asked to do that ACE score, and it's really eye-opening to find out that their score is pretty high, that they have actually had a lot of traumatic incidences that occurred when they were younger. But the thing that the ACE score misses is the adverse community experiences. So not everything that happens that's bad happens in the home. Sometimes what's happening is the stuff that's outside the home. So if you grow up in a neighborhood that's dangerous or feels unsafe, if you're enduring ongoing oppression or discrimination, I mean, that's traumatic also, but it doesn't really get captured when people come in and talk about their past. Like, they don't always come in and say, hey, I've been discriminated against since I was, born, and it's still happening now, and it's been painful and hurtful, and it makes me feel less than in my own community. But that's what, part of good trauma treatment is, to ask those kind of questions, and to look, really, when I'm doing an intake, I'm not looking at the past as much. I'm looking at now, and where are you stuck now? And then the client and I together root it and trace it to the past. And that can be really eye-opening when you have a history of addiction. Because a lot of people come in feeling like, I'm weak, I'm a loser, I'm a failure. They don't really understand why they've gotten so self-destructive, and why the addiction has gotten so out of control. But if you can trace it back to the past and understand it as something that you learn to do to survive, it makes recovery a lot easier. Everything's a lot easier if you're not ashamed, if you can really understand. So what I love about evidence-based trauma treatment for addiction is that it really helps people see that, understand themselves more.
Yeah, you specialize a lot with EMDR. Maybe talk a little bit about that, and the benefits that you see with it. I mean, there's countless research, as you said, just on how, the efficacy of it.
Mm-hmm. Yeah, a lot of evidence to back up EMDR or exposure therapy or different cognitive behavioral approaches. I got trained in EMDR because it was the one that was available to me at the time, but I happen to really like it because it is it's an approach that includes, how you feel about yourself because of what happened, but also how you think because of what happened, and how it affects your body. So it includes all of those things. It's an exposure therapy, which most trauma therapies are, where you bring up the past memory, and then you work through that past memory, and really work in how that memory is stored. So the memory is stored. When you have PTSD, yesterday is now. So if I'm sensitive to noise and there was a loud noise, all of a sudden yesterday's now. I'm going to act now the way I would have in the past when there was a loud noise that sounded the same. So when you do EMDR, you help people restore the memory so the yesterday is yesterday. It doesn't change the fact that it happened, but what it does change when a memory is stored correctly is the fact that the brain knows it's in the past. That can be really, really helpful when you're trying to get some recovery under your belt, if you can just be in the present right now, with the knowledge from the past, but not the reactivity from the past.
I love that, thinking about it as yesterday is now yesterday, because it's so true that a lot of your instinct, a lot of your reaction comes from that place of feeling as though there's that imminent threat in the present, even when there isn't.
Correct. Yeah, and you can go into fight, flight, freeze, please, the different states that people go into when they've been traumatized a lot. So some of us will get angry and fight when we don't want to, but when we feel triggered, that's where we go. Some of us can be really pleasing, and that's not necessarily great for us. Saying yes to things we shouldn't say yes to, or we might freeze, or we might run. And I think those are all things that people who have histories of addiction can relate to, getting stuck in those states and reacting in those ways, not by choice. That's what I love about evidence-based trauma work, is that it brings choice back. When you have trauma, your brain doesn't give you a lot of choices. It's like fight, flight, freeze, please. Like, it's about survival. When you work through your trauma, so I use EMDR to work through it, people come back and say, oh, wow, I noticed I had a choice. Like, I could do something different. Like, that person was really annoying to me, but I didn't get all fired up and feel like I had to fight. Or that person was, somebody I would usually freeze with, but I found my voice. So it really gives you choice. And that's what I love about my work as a social worker. That's why I got involved with trauma work and addiction work, is that I felt like it would be nice to have choices, not feel like you have to live in reaction to the past.
Well, and that's where we see a lot of folks sometimes going down that pathway with addiction and with substances. Talk a little bit about how those two really play in with PTSD, and then, is it one caused the other caused one? You don't know which one came first necessarily sometimes, I'm sure.
Yeah, well, they kind of play off each other. But I think actually there's a lot of evidence to say that it is the negative life experiences that lay the track for the vulnerability to addiction, and that they feed the continued behaviors, and also interfere with the ability to ask for help and take help. So if you can go back to that root and work on what you learned that was kind of faulty, like I'm not safe, there's something wrong with me, I can't ask for help. You can go back to the very beginning, work it through so you realize, okay, I can learn from the painful past, but I don't have to keep acting through my painful past anymore. Then recovery becomes a little easier for folks.
Do you have any moments that stick out to you in your career and with your experience where you just thought, this is why I do this work? Is there something that really sticks out to you? I'm sure there's countless moments, but something where you really, it speaks to where you have this passion.
Yeah. Oh, there's like a million moments. I was a short order cook before I was a therapist, and that seems like a weird thing, but one of the things about being a short order cook is lots of information and lots of things come in and they pile up, and you've got these like tickets in front of you, and it's overwhelming. And what I learned from that is that you just take one ticket at a time and you work at it a little at a time. And a lot of times early in my career, when I would get overwhelmed by my work, I would think the same thing, just one thing at a time. But why I like the work is because of the incredible shifts and changes that I've seen. I got into the work as a grassroots organizer and in the hope of making some kind of systemic change. And then I ended up kind of going sideways and ending up doing individual work with people, because I realized that when one person changes, their whole system changes. So if one person is a better mother or a better father, things are different in their family, but they're also different in their community, and they're different and they can make a big impact on the culture. So I like the ripple effect. I like the justice piece, that bad things happen to people that make them vulnerable to more bad things, and one thing that we can do is go back and at least not have them continue to function as if the bad thing is continuing to happen. So I liked all those things, but also I came from a family with a lot of addiction, and that didn't make me negative about addiction. What it did was reminded me, like, I love my family members. I love the people in my family. They were hardworking and they struggled, but they couldn't get help often when they wanted it. That help, the places they went for help gave up on them very quickly. So I got into the field because of that love, not because of not liking addiction, but more understanding that people are nuanced and they're more than their addiction. So I liked being a part of that, like seeing strong, great people get the lives they were supposed to have, and also providing services that were not available to the people that I care about when I was growing up.
So you speak about those services that were and weren't available. How have you seen the industry change since when you started your career to now?
A lot. Like if it didn't change, I'm pretty sure I'd be cooking again. Because when I started 30 years ago, I was basically trained to push people down one pathway in recovery, just one. And it was kind of like my way or you're in denial, or my way or you're resistant. And I remember thinking, it wasn't a very popular opinion, but we were sitting around a table with a group of professionals, and somebody wasn't making it the way we wanted him to in recovery. And somebody said, well, the person must not have hit bottom. I'm like, and I was the representative of the client. I'm like, no, I'm pretty sure it couldn't get any worse for her. But I'm wondering why every time there's a problem, we're always blaming it on the client. Like maybe we ought to look at the system. Like what are we offering her? There wasn't a lot of choices for her 30 years ago. There are a lot more choices now. You can get into a women's group. You don't have to go to a co-ed group if you don't want to. You can choose many paths of recovery, and you can get a ride there. And there's harm reduction. I mean,
Just gonna say, with harm reduction,
yeah.
it kind of makes recovery look different for everyone.
Yeah, so it's okay to get therapy, and you can get therapy. So the options are different, but our attitude is different. As professionals, it's much more open. Like I ask my client, what is the definition of recovery for you? Where do you want to go? And I'll work with you in the way you want to work, instead of feeling like I had to push people certain ways. So yeah, our field's changed a lot. We're a lot more trauma informed. We have a lot more choices. I don't have to hunt around to get Narcan when I need it, or when I need a harm reduction kit, I can get it, or I can just call my harm reduction person in my community. I mean, things have changed a lot, and that's really hopeful for me.
And in looking at maybe the treatment prospect from maybe the folks you worked with early on to now, do you think it's maybe easier to achieve that sustained recovery or whatever your recovery goal is now, given all those other options? Like, are the recovery outcomes better now in terms of what you're seeing with your clients?
What I saw in my clients, yes. I saw that people got more invested and more interested in their therapy. That many of my clients, they could teach a relapse prevention group. Like they knew a lot. They had been in treatment multiple times. But when you're triggered, you can't hold on to that. So when you know something, like this is my skill, or I know this about myself, but when you're triggered, you can't access it. That happens a lot with PTSD, is that when you flip into your survival mode, fight, flight, freeze, please, you're not thinking about that skill in group, you know. And so what I saw with my clients is that after they did the trauma work, all those skills, they could access them. And many of them teach them, and many people that I've worked with have come into our field. That's part of what happens sometimes when people get better. They want other people to get better, and many people end up doing this work. So a lot of my former clients are now leaders in the field and advocating for people in recovery. And that's very gratifying, because in my lifetime, maybe I can work with, 1,000 people. But if I am working with people who then go on to help a lot of people, that's a big ripple. So that's where I started to think, well, maybe this work I'm doing with people individually is grassroots organizing. Maybe it is bigger than I thought it was.
Well, and it's like you said, if that person becomes a better mother or father, it's changing the whole dynamic, which you hear a lot about generational trauma and trauma that lies within the family lineage. And so fixing that with one person could be fixing it for the generations to come.
Yeah. Yeah, and that's the hope. The hope is that we put ourselves out of business, right? Is that we could all go do something else because there's no need for the services we offer. But we're not there yet, because we're not there as a culture yet. I mean, there's the individual trauma that we can look at and help people undo, but there's some big cultural things that push addiction and push pain for people. And as a culture, until we treat people in pain like somebody who deserves help and deserves help right away, until treatment on demand is available and an array of choices of therapy is available in all settings, including for folks who are incarcerated, we're missing those opportunities, and we're probably going to be doing this for a while longer.
What do you think is still the number one barrier that impacts folks' ability to seek recovery, to get into treatment, whatever that may be for them?
Well, I still think it's hard for people to get treatment when they want it, when they ask for it. That at least what I've seen. I don't think in all areas it's like that, but it's been hard for many of my clients to access treatment when they need it, and also to have it be ongoing and long term. When you've had a lot of trauma and you don't trust people, it takes a while. It takes a while. And then if you're constantly moving around or getting discharged and moving to different people, it's hard to develop the trust you need to do the work you need to do. Ideally, what I'd like to see is places just like we have in all of our areas. We all have primary care doctors we can go see, like where you can go get screened, then you can ask for the level of care you're looking for, and that it would be ongoing. And I think we're doing better at that in Connecticut and making that happen, but we probably still have a little more work to do. And I'd like to see treatment available as a choice for folks who are incarcerated so that people can come out healed. A lot of people who fall into the fight category of PTSD end up incarcerated, and punishment has never made anybody healed or better, So if we could have treatment on demand there in that setting, you don't have to take it if you don't want to, but wouldn't it be nice if it were an option,
Well, because we see then the patterns repeat themselves, right?
Yeah.
Like the recidivism rates are so high that folks end up
come
back
out healed. I'm working with a project in Chicago, and at first there was a lack of interest in offering EMDR within the prison setting that people were in. And they were worried that it would make people more activated and there would be more violence on the what they call the recovery pod. And then when they implemented it, it was just the opposite. People calmed down. There was less fighting going on. When people got out, they did better. And now they're a big fan, So it's just, it doesn't need to be EMDR. It could be any form of trauma treatment. But trauma treatment helps people feel better, helps them make better choices. So it's kind of a no-brainer, to have it available should somebody want it.
Is there a commonality that you see in most of your patients who are suffering from PTSD or have a history of it? Is there something that you can kind of see as a link between all of them?
One of the themes that I work on a lot with folks in recovery is difficulty asking for help, because either not trusting the system or not trusting others, trying to do everything alone. Struggle with the difficult memories, struggles with relationships in general, and a lot of lack of confidence in self. When you have an addiction and you wake up in the morning and you cannot predict how your day is going to go, it really takes a toll on how you feel about yourself, and that's one of the gifts of recovery. You wake up in the morning and you're like, okay, I know what I did yesterday and I can kind of predict what I'm going to do today. So if you have PTSD and a chaotic and unpredictable childhood, and then your addiction recreates that, it's pretty painful. So a lot of people that I've worked with have to struggle with asking for help, with all the things. You never notice in recovery, everything we ask of people is to do something with other people. It's like everything. It's like go to a meeting, get a sponsor, ask for help, call for help, because other human beings are really valuable for recovery. But other human beings, when you've had a lot of trauma, are the problem. So one of the biggest barriers is helping people trust other people, and our system is getting better at doing that, but could do more. It's about being predictable, being safe, offering, helping people when they ask for it.
When you're entering treatment, it can seem a little daunting. Like you said, that lack of predictability and you don't know what to expect. Maybe you've never asked for help. What are some ways to kind of debunk that for anybody who might watch this and it's just so new to them or so foreign? What do you think that are the basics that they should know to expect to kind of make it seem more accessible or at least more plausible that they can do it?
Yeah. I think it's very, very brave to go into recovery. It's very brave to go to another human being and start telling him about your life, and I think sometimes it's hard to know the difference between our good instincts and our history of trauma. So sometimes I think it's good to take a breath, sit with the person, get used to them, get used to asking for help. Notice when you feel like, okay, I need to pull away or I need to quit, and ask yourself that, is this because there's some real evidence that tells me that I really shouldn't trust this person, and that can happen, and it's okay to stop and find someone you can trust? Or is this my history telling me what to do? And just sitting with it and getting to know that. And the best gift you can get in recovery is to really be able to sit with things, understand what's going on with you, and make choices based on that. and try to distinguish between some of the negative things you've learned from the past and also some of the positive things that you've learned. And that's what a good counselor, therapist group can help you do, but that it's going to be hard to get into recovery without using help in some way. And so you're going to have to take a breath and step forward and give it a try. But just know that that you have control over how long you stay or if this is the right person for you. But at least give that person a chance to be there for you.
And especially when you're starting out, what are the recommendations that you abide by when it comes to the treatment? How often is someone doing it? How long is it? What does a day look like? What does a week look like for that patient?
Do you mean when I'm working with them as a therapist?
Yeah.
Yeah. That it's a mutual relationship, that we choose the treatment plan together, that I want them to feel safe, and I'd like some, as much as they can, to be as honest as they can about what they need and want, and that we're going to give it a try, and that I might not be the right therapist for them, but that we'll try, and then after about 3 sessions we'll check in, just feel like the right person for you, no, maybe yes, we keep moving forward, and that we create the treatment plan together, and that we get to know each other over time. Trauma work's very hard work. So in order to do trauma work, all forms of trauma work involve some level of exposure. So you have to go to some pretty dark places. So also I want people to be ready, and tell me when they're ready. So when I'm doing therapy, I'll do a lot of regular talk therapy, counseling, harm reduction work, and then when the person's ready to do the trauma work, together we create the treatment plan.
So something like EMDR.
Mm-hmm.
How long is a session? How does that kind of work? Explain to someone. I think some people either have heard the term or maybe loosely know, like, the light bar or something like that. Explain, I guess, for someone who has no idea what EMDR is, let's go a little deeper into that.
Yeah, it really looks very different depending on the person and their goals. But also, because I'm like 100% insurance, I don't get to pick how often and how long,
I'm sure another a treatment barrier that we can put down on our list, right?
So I would see people once a week, and usually the sessions were about 50 minutes long. But a typical EMDR session is you and I have picked out a memory together. I've asked you, are you okay with starting with it today? You bring the memory up, we go over it in detail, and basically I trigger you to think about the memory, feel the memory, and that's where we apply the eye movement, and I work with you step by step to work through the memory. It's kind of hard to explain, but the end result is that I can remember the memory. I know that it was a bad memory, but I no longer identify it like I'm bad or there's something wrong with me. Identify it, I was a kid and I did the best I could. And when a memory is correctly stored like that, I don't reference it in the same way. I can look back and say, I was a good kid, my parents did the best they could, but I'm not reacting to it now. But yeah, typical session, if we worked on a really tough memory, some people can work through a memory in one session, but most clients that I work with do pieces of it and end up working through the memory after about 3 or 4 sessions.
I have to imagine that's scary in and of itself, right? To know that you're going to have to relive it to get through it. It's like that expression, there's no way around it. You got to go through it, right?
Mm-hmm. But you don't relive it. If you relived it, that would be a problem. You actually experience it and feel it in the relationship. So if I were having you bring up this tough memory, I'd be checking on you, asking you what you're noticing, saying, remember, you're here with me. So
you're not reliving it like you were when you were maybe initially by yourself. You've got that person in the room guiding you through it.
Right. I do a lot of work on addiction triggers, and I had one client say to me, it's the first time that anyone's ever stayed and sat with me during a trigger where I felt like getting high, and it went from a beginning, the middle, and the end. He said, it's a lonely, lonely thing, going through this alone, and I felt like you were with me this time. And now I'm at the end of it, and I feel no longer triggered. So people feel that way. It's brave work, it's hard work, but it's really hard to live with it when nobody's with you. So one of my clients, I was nervous in the beginning with EMDR. I didn't want to trigger him. I didn't want him to relapse because of our work. Or he said to me, I have nightmares every night about this. I think about it all the time. He said, you're not going to make it any worse by bringing it up here. And I really, everything I learned about EMDR in this work came from clients like that. He's like, I'm good, Hope. Like, how about you? Are you good? I'm like, yeah, okay, I'm good. So, I mean, I think people in recovery are quite brave. They've lived through a lot, that having them work through a memory with you is no more difficult than what they already go through every day.
Well, then on that same, part where you're just saying your patient's asking you if you're okay, there's got to be a lot of, vicarious trauma risk for the provider involved. Because, I mean, what you're hearing is not easy to hear. And I think a lot of something that's very common in social work is you have that, empathy, and you're caring, you're compassionate. So sometimes I imagine it must be hard not to take some of that on or take that home, or, just kind of put it away at the end of the day.
I don't have that experience, but I didn't know that was going to happen. I thought that was going to happen. What happened was, one of the awful and most difficult things I've worked through with people lately is loss of a loved one to an overdose. Like, I can't think of a good resolution. So when it was mostly mothers were coming to me for help with this, I thought to myself, how are we going to get through this? Like, I don't really understand how this is going to work, because it wasn't a good ending, But what I found was that people can work through loss. It's possible to get through it. What makes loss harder is if you have any irrational thoughts about it, like, I should have done more, or I should have been there, or I wasn't a good enough parent. When I help these mothers, primarily mothers and some fathers, work through this loss and get to the other side, what I learned is that people can do it. And there's an incredible journey, and it's very individual. Everybody works through loss differently. You can get to the other side. Doesn't mean you're not going to be sad and miss that person forever, but it doesn't have to be so traumatizing. And that's what I've seen in trauma work over time, is that what I thought was unresolvable. For instance, I was working with a woman who, during the course of her using drugs, wasn't probably the parent she wanted to be. But her mother wasn't really the parent she wanted her to be. So when we worked on these childhood memories, the interesting resolution she made, I just stayed out of the way. What she got to with it was, if I can forgive my mother, which I feel like I can, then I need to forgive myself for my mistakes. I didn't see that coming. I didn't know how she was going to work through it. And so that makes me feel, as a human, like human beings are capable of overcoming difficult things. And that my job as a therapist is to be there and to help them work through it in the way they're supposed to work through it. So, and they're brave enough to bring it to me, then I have to be brave enough to sit with them while they're doing it. So I feel honored to have helped people in that way, and I don't worry that people can't work through it, and I don't find it traumatizing. I find a system that keeps hurting people more traumatizing. So I'm more traumatized by insurance companies cutting me off and giving me a hard time, or not being able to get a detox bed when my client needs it. Like, that stuff traumatizes me.
Mm-hmm.
Sitting with another human being and having them work through their pain feels kind of like an honor to me. So
That's a really interesting perspective, and I'm sure a lot of counselors listening to this could benefit from that, because I say all the time, I'll sit and do patient testimonials, and they'll share their story with me, and I just think of our counselors who have these huge caseloads, and they hear some of these stories day in and day out, and you just got to tip your hat to people who are doing that work, because it's so brave and so needed.
Yeah.
And you're really that person for your patient that they maybe never had.
Yeah, and it's not that we don't need help, because we do. I've had to do a lot of my own work in order to be able to do this work, to understand that there's limitations to what I can do. As a child, I wanted to save people in my family, so I have a tendency to do that as an adult. But I've gotten help myself, consultation, therapy myself, so that I know the limits of what I can do. So I think we do get exposed to a lot of things, and I think we do need to seek help. But I think we also have to do all the things we also tell our clients. So I tell my clients to have a big support network, make sure you ask for help. I better be doing that for myself, and so I do try to take really good care of myself and make sure, if I can't be hopeful for a client, if I can't see a positive ending for them, then I'm going to go talk to somebody about it. Because if I can't see it, then I shouldn't be working with them. I should be able to be hopeful at all times. And if I can't, That doesn't mean I don't have bad days and and want to go back to being a short order cook again. I certainly do. But I mean, it means that sometimes I need to I have to step back and, fill my cup up so that I can be there for somebody else.
Is there anything that you think we haven't covered when it comes to PTSD and addiction treatment that you wish people knew, or that, I'd be doing a disservice if I didn't have you speak on it?
Well, just like we know that recovery from addiction is possible, what I love about PTSD is recovery from PTSD is possible. You're not born with PTSD. Generally, I mean, some people are traumatized very young, but you're not born with it. It's not a biological condition. It's something that happens to you because something happened to you. And to me, that's very different than other things. So I see it as resolvable, and we have evidence-based treatments for it. So if anybody listening knows that they have a history of trauma, knows that they have PTSD, I would like them to know that it's possible to work on it so that you don't have it anymore. And it's very possible to get into recovery for both the trauma and addiction.
Well, Hope, we thank you so much. And, I couldn't help but think about it as you were saying hopeful. I said, as much as you loved root being in our name and getting to the root, I said, Hope being hopeful, that's a pretty good name for the work that you do. So thank you so much for joining us. It really was a pleasure chatting with you.
Thanks for the opportunity.
Well, we hope you enjoyed this episode of our podcast, Recovery with Root. As always, stay connected with us on social media to learn about when next podcast episodes will drop. You can comment, ask questions, even let us know about future topics that you'd like to see discussed. Until next time, remember, progress is the destination.